In this video, I'll reveal 3 unexpected reasons why more women have insomnia. Stick to the end and I'll go over what you can do to improve your sleep, even if you've tried everything. This applies to men as well, especially if you don't have sleep apnea. Hi, I'm Dr. Stephen Park, an ENT surgeon and sleep medicine doctor, with a passion for helping you breathe better so that you can sleep better and have the energy to enjoy living life again. If you find these videos helpful, please like and subscribe to my channel. You can also help others sleep better by helping more people find my video content. One interesting study I came across many years ago was the finding that most primary care doctors tended to prescribe sleeping pills for women if they complained about trouble sleeping. This was in contrast to men who are more likely to be sent for a sleep study to diagnose obstructive sleep apnea. This may seem like a sexist bias, but statistically, a woman is more likely to have insomnia. Even if a sleep study was ordered in women, they are much less likely to be diagnosed with sleep apnea. Even female doctors were biased. One major reason why this happens is because of the way sleep apnea is described in lectures and textbooks. Obstructive sleep apnea is commonly described as being found in middle-aged, overweight, snoring men with a big neck. While this is more likely, it's also been shown that you can be a young, thin woman who doesn't snore at all and still have severe sleep apnea. Yes, gaining lots of weight can definitely make sleep apnea worse, even if you start off with normal jaw structures. But most young, thin women with sleep problems have very small jaws and narrow upper airway anatomy to begin with, which predisposes them to sleep problems because they can't breathe properly at night. Now let me give you the 3 reasons why more women have insomnia. The first reason doesn't explain why more women have insomnia directly, but you'll see a little bit later why this is so important. In my other videos on the difference between sleep apnea and upper airway resistance syndrome, I described how apneas are scored on a sleep study. Obstructive apneas are defined as complete breathing pauses for more than 10 seconds while you're still trying to breathe in with your lungs. Hypopneas are scored when you're partially blocked for more than 10 seconds, along with a drop in your oxygen levels or your brain waves light up from deeper levels of sleep to lighter sleep. I won't go into the more technical details here, but the important concept is to appreciate the 10-second threshold. To be diagnosed with obstructive sleep apnea, you need at least 5 apneas or hypopneas every hour on average, along with at least one of these other symptoms, such as daytime fatigue, cognitive dysfunction, high blood pressure, heart disease, memory loss, or insomnia. But let's say that you stop breathing 25 times every hour for 9 seconds each for each episode. Then your sleep apnea score, or the apnea-hypopnea index, is 0. So here, you won't have dangerously low oxygen levels, but your sleep is extremely fragmented. This leads to a chronic state of stress in your body, leading to fatigue, anxiety, headaches, digestive problems, and hormonal imbalances, to name a few. This is called upper airway resistance syndrome, which I cover in more detail in my other videos and also in my book, Sleep Interrupted. The second reason why more women have insomnia is because they have smaller anatomy and airways. I mentioned this finding before in another video that women's jaws are much smaller, along with a more recessed lower jaw, which is a chin. This is on top of the finding that all modern human jaws are shrinking due to various behavioral and environmental factors, which I covered in other videos. If you look at the space behind the tongue in the back of the throat, it's much more narrow than in men. So if a woman's throat muscle is relaxed during sleep with total or partial obstruction, she's much more likely to wake from deep to light sleep. Once this happens, it can last anywhere from 3 to 5 seconds to well over 10 seconds. If you go over 10 seconds, then it'll be scored as an apnea or hypopnea based on how blocked you are. One side note I want to mention here is that your throat has protective reflexes against various dangers, such as pressure sensors that detect closure of the upper airway and chemical receptors that detect acid in the throat. When the body senses either, the primitive part of the brain will wake you up quickly to breathe or swallow so you don't choke or aspirate. But with long-term exposure, your body gets desensitized and the thresholds to respond become higher and higher. One great example of this was shown by one of my professors while I was in medical school, Dr. Jonathan Aviv. He placed a flexible fiber optic camera right on top of the voice box and puffed a controlled amount of air into what's called the AE fold, which is a delicate fold of tissue on top of the vocal folds. At a certain pressure level, the vocal folds quickly closed off, protecting the airway. However, in people with chronic acid reflux exposure, it takes much higher air pressure levels to trigger the response to close the vocal folds. This is a form of chemical desensitization caused by bathing your voice box with small amounts of stomach juices brought up with every apnea episode. A similar study found that in people who snored, their perceptions of two sharp objects on the soft palate had to be much further apart before they could tell there were 2 points. This is a form of tactile or sensory desensitization caused by long-standing snoring vibrations. It's like what happens when you use a hand sander for too long. Your hand feels numb. If you expose your voice box to stomach juices on a long-term basis, or if you have numbness of your throat tissues from chronic snoring vibrations, then your protective reflexes to wake up will be delayed. As the delays get longer and longer, the more your oxygen levels drop, and you'll go from upper airway resistance syndrome to obstructive sleep apnea. It's important to realize that reacting quickly to any potential danger to your airway is normal. But if you overreact too often due to repeated breathing pauses, that will cause problems. Dr. Christian Guilleminault, one of the founding fathers of sleep medicine, found that about 13% of people with upper airway resistance syndrome progress into sleep apnea every year, especially if you gain weight. The third and last piece of the puzzle involves the reproductive hormone progesterone. In menstruating women, progesterone goes up significantly just after ovulation in the luteal phase. Progesterone is known to stimulate breathing and respiration, causing higher muscle tone in the genioglossus muscle. This muscle connects the back of the tongue to the middle part of the lower jaw and is the most powerful upper airway dilator as you breathe in. Estrogen also goes up as well along with progesterone, with some effect on promoting breathing, but not to the same degree as progesterone. It's also been shown that premenopausal women have much higher genioglossus muscle tone compared to men. This makes sense since the airway behind the tongue is smaller, along with being much more sensitive to any amount of obstructed breathing. This makes women more likely to wake from deep to light sleep at lower thresholds, supporting the observation that women tend to be more light sleepers. This may be useful to hear the baby crying when hungry or when there's potential danger. All these factors beg the question, how can you tell if it's true insomnia versus a sleep breathing problem? Insomnia is a very common sleep problem that millions of people suffer from regularly. There are many different reasons for insomnia. Fortunately, most cases of insomnia are temporary and are usually treatable with good sleep hygiene routines and cognitive behavioral therapy. Personally, I suffered from severe insomnia before every major standardized exam. Typically, I slept no more than 2 to 3 hours before each of these tests. However, there are many people who have severe treatment-resistant insomnia for weeks, months, or years. Nothing works, including multiple sleeping pills. And here's what I think is a landmark study by my friend and colleague, Dr. Barry Krakow, who addressed this topic. He published a study in eClinical Medicine, which is the Lancet journal, in 2019. He recruited over 600 patients with complex insomnia, and after excluding anyone with possible sleep apnea based on physical exam and sleep apnea screening questionnaires, he was left with 40 subjects who completed the study. Essentially, he wanted classic patients without any sleep apnea. On average, these patients had treatment-resistant insomnia for about 10 years. They all underwent in-lab sleep studies, and all 40 were found to have obstructive sleep apnea, with an average AHI of 19, which is in the moderate range, and this ranged from 14 to 25. They were then randomized to receive 14 weeks of either CPAP or adaptive servo ventilation, also called ASV, which is an advanced automatic bilevel device that's most commonly used for people with hard-to-treat central sleep apnea. The results were surprising. 68% of people who received ASV were cured of their insomnia based on a standardized insomnia severity index score of under 8. Even in the CPAP group, 24% reached an insomnia severity index of under 8. Before the study, the insomnia score was 19 for the whole group. And note that 65%, or almost 2/3 of these study participants, were female. What this study shows is that most people who have long-standing treatment-resistant insomnia have obstructive sleep apnea, and that ASV treatment helped to resolve insomnia in 2/3 and in a quarter of those who got CPAP. This study used pressure devices, but in theory, you can also use other treatment options for sleep apnea, such as mandibular advancement devices or even surgery. You can even argue trying tongue exercises or acupuncture for insomnia, since both these options lower sleep apnea severity by 50% on average. I also have to stress that you can never separate out basic insomnia due to bad sleep habits or negative thoughts from a sleep breathing disorder, such as upper airway resistance syndrome or sleep apnea. In most cases, you probably have a combination of both, since so many people have undiagnosed sleep breathing problems. It's also likely that younger patients with chronic insomnia will have upper airway resistance syndrome, whereas older patients will have sleep apnea, especially for postmenopausal women when progesterone drops almost completely. So as you can see, the perception that more women have insomnia may be an artifact of our sleep testing criteria, with many women, including men, who suffer from problems breathing even if they don't meet the formal criteria for sleep apnea. Regardless, if you suffer from insomnia, first go through these 10 basic sleep hygiene steps. Number 1, don't eat or snack within 3 to 4 hours of bedtime. Number 2, avoid electronic screens 2 to 3 hours before bedtime. Read a book in dim, soft white light, and avoid LED lights. Number 3, avoid naps in the afternoon. Number 4, block out your entire bedroom. Number 5, keep your bedroom temperature a bit on the cold side since colder temperatures promote sleep. Number 6, do relaxation or deep breathing exercises before bedtime. Number 7, if you can't fall asleep for 20 to 30 minutes, get out of bed and read a book in dim incandescent light for 10 to 20 minutes. Number 8, get regular exercise outdoors during the day if possible. Number 9, get your vitamin D level between 60 and 80 nanograms per milliliter. Systemic meta-analyses have shown better sleep quality with higher levels of vitamin D. One study giving high-dose vitamin D to 940 adolescent girls improved cognitive ability, insomnia, and daytime sleepiness. Number 10, try melatonin, valerian, or any of the many natural sleep aids you can find online. You won't know if it's going to work until you try it. Avoid prescription sleeping pills. Benadryl with the generic name diphenhydramine may help, but it's not good for your brain if used long-term. I talk about Benadryl and the link to dementia in seniors in another video, which I'll place a link to below. If you're still struggling with insomnia despite all these conservative steps, see a sleep doctor who specializes in cognitive behavioral therapy for insomnia, or CBTI. It's been found to work just as well as sleeping pills, but works much longer without being addicted to prescription pills. However, even if you don't have any signs of possible sleep apnea, such as snoring, daytime fatigue, memory problems, nighttime urination, or increasing weight, see a sleep doctor to test for sleep apnea. And if you're found not to have sleep apnea, then you're most likely to have upper airway resistance syndrome. Typically, there will be clues in the sleep study suggesting sleep fragmentation, such as lots of brainwave arousals and what's called flow limitation. If you're overweight, it's a good idea to switch to a healthy diet and incorporate an exercise regimen to lose weight. It's been found that losing only 10% of your body weight lowers your sleep apnea score, or the AHI, by 26%. And as the ultimate last resort, if nothing that I mentioned here works, find an ENT surgeon who can perform a drug-induced sleep endoscopy procedure to see if you have what's called epiglottic laryngomalacia. I covered this relatively common but rarely diagnosed condition in this video above.